Welcome back. Earlier, we told you that Lagos, Nigeria's commercial capital, is recording an increasing number of deaths related to the COVID-19, but a number of people still don't believe the virus exists. Our correspondent Adedoja Salam-Adeniyi did an exclusive report of visiting the infectious disease hospital in Yaba, which is grappling with more patients. Her report.
The past 1 week has seen a geometric progression of infections of COVID-19 in Nigeria. Lagos is still the epicenter, recording more infections. Since the new variant of the virus was discovered in the UK, many countries around the European country restricted movement into the UK. Nigeria, one of the UK's allies, refused. Rather, the government insisted travellers must produce a negative PCR test before coming into the country. This directive left a gap for some unscrupulous Nigerians to cash in and make bricks business. This corrupt practice has made it possible for some travelers from high-risk countries to find their way into Nigeria with the new variant, which doctors say it is deadlier. The second wave, they say, is more aggressive and spreads like wildfire than the first, and the vaccine is far from finding its way into Africa. Months ago, the ICU had few patients, most not using ventilators. But now, the use of oxygen is on the rise. These are the used oxygen cylinders from this ward alone. About 70 were used overnight. They are rolled out for refuel. Filled ones are also rolled in with the same speed. After meeting with the Commissioner for Health, who has now relocated his office from Alawusa to the IDH on the directive of the incident commander, Babajide Sanwo-Olu. Our first port of call was the Biobank, is one of the red zones.
You can see that
This is the Kakovid ward. Most of the patients here can hardly breathe on their own without oxygen. Globally, there is oxygen supply chain crisis. The demand for oxygen overweighs the supply.
this facility here can produce 60 large cylinders in 24 hours. That's a day. So that's very helpful and will add to our daily consumption of oxygen, which we are currently using about 300 cylinders a day.
The flow rate of oxygen that the average COVID-19 patient uses is 15 liters per minute. Now it tripled. A regular sick patient uses 5 liters. At the IDH, the consumption of oxygen is now very high, as the life of most patients with COVID-19 hangs in the balance.
It seems like it's affecting a younger age group. It seems that when you catch this COVID, that it can cause respiratory failure faster than the first wave. And we don't want people to die. So, we want to be able to admit people in a way. So the place is almost full, but we have more capacity outside and other isolation centers. So Lagos has excess capacity.
People come in breathless, and then when you measure the oxygen concentration level in their blood system, some come in with very severe oxygen concentration level. Then the organs of the body cannot begin to suffer some form of damage. And this damage will actually become irreparable. You know, somebody coming into the hospital with an oxygen level of, say, 20%, because we've seen them 40%.
The only thing to keep their weak lungs alive is this oxygen. A struggle to stay alive. It's a fight they must win. But others with underlying ailments like obesity, high blood pressure, and diabetes, and even chain smokers in most cases, are helpless, as COVID in most cases wins the battle.
Patients from Alimosho, Ikorodu, Ketu, Ojota, Alapere, Iponri, Epe, Badagry, Surulere, among other Lagos local council areas, are here receiving treatment. To say that COVID-19 is the disease of the rich is a fallacy. Emmanuel here is from Surulere area of the state.
It's a terrible experience. It's a terrible experience. You cannot be comfortable for anything. You're not comfortable. You don't even feel what you're eating.
This first place I went to was I think the Holding Bay.
So what did you see there?
All of a sudden, the next day, the man just died. I think loss of oxygen, the man died. And they said before then, somebody had died. So it's real, it's real. If they can ban public outings, honestly.
Before now it was fever, loss of smell, loss of taste. But right now it's just intermittent cough.
48 hours before this recording, 7 people have died. More are lying on the sick bed, and more stretched into the facility, showing the severity of the second wave of COVID-19 in the country. But the frontliner health workers are not giving up as they fight to keep all their patients alive.
Septitazane, I don't care attitude and relaxation of safety protocols and guidelines have been said to have led many into that hole. Until people adhere to safety protocols, the second wave will not abate, and the third wave might knock harder. Adedoja Salam Adeniyi, TVC News, Yaba, Lagos.